I want to welcome everyone to the presentation of Dr. Lockwood's book, President Hall, distinguished guests, and Dr. Lockwood. This is going to be one of those really short introductions, so we just go ahead and get started because I know all of us are going to have a lot of questions when we're done. So, Dr. Lockwood, can you go ahead and begin?
Mike and President Hall, it's a great pleasure for me to be here this afternoon to talk to you about the relationship between burning coal primarily in the United States for the production of electrical energy and health. Just by way of a little further introduction about myself, I'm a neurologist. I've been on the faculty of the University of Buffalo for about 20 years. I'm now retired. But people ask me how I'm liking retirement, and I say, I'm so busy with stuff related to this book that I can't imagine how I ever managed to find time to work. So for the last several years, I've been working on this book project, and for the last 2 months on various tours, speaking to audiences primarily in the United States, but now for this week in Kosovo about this topic. So I'd like to begin with a definition of health, since that's what I'm going to be talking about. And this is the definition adopted by the World Health Organization in 1948. It says that health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Since I'm a practicing physician, or I was at one time, it's altogether too easy for me as a neurologist to focus on disease and infirmity and forget about the mental and social aspects of society and health. But this is really an important thing to bear in mind because it really is an essential part of what real health is all about. Now, how did I manage to get interested in coal? Well, in the United States, coal forms about 43% of the energy sources that are used for generating electricity. Now, this varies quite a lot from state to state. Some states, like the state of Iowa, where I was a couple of weeks ago, 20% of the electricity is generated by harnessing wind energy in that state. And in other places, it's virtually 100% by coal, and there's a mixture in between. The percent that's attributable to coal is falling for 2 reasons. It's very expensive to upgrade existing coal-fired power plants to meet contemporary pollution standards, and the price of natural gas at home has fallen to quite low levels. So in many instances, it's cheaper to convert an old coal-fired power plant to a somewhat newer and modified natural gas fueled power plant. Now, these are data that were published in The Lancet, which is one of the leading peer-reviewed medical journals worldwide, in a series on energy and health that was published in 2007. And in this series of articles, they tabulated some of the health impacts of using various energy sources to generate electricity. And as you see at the top, lignite, which is a form of coal, it's as it's referred to as the lowest rank of coal, where there are different classes of coal, and low rank means bad quality, has the highest disease and death rate associated with its use to generate electricity. And these are data that were based on studies conducted in Europe, so they're entirely applicable to the situation here in Kosovo. And as you see in this table, there are just over 30 deaths per terawatt hour of electricity generated using lignite as the fuel source, which is the fuel that's used in both the Kosovo A and B power plants, and the fuel source that's for the proposed Kosovo C plant. Now, in addition to the 32 some deaths per terawatt hour, are almost 300 serious illnesses, and by serious illnesses they mean heart attacks and strokes, things like that really are definite endpoints on the health spectrum. And then over 17,000 minor illnesses, and these might be something as minor as a sore throat or not feeling well enough to go to work or to school, to somewhat more serious illnesses. And all of these health impacts have a cost to society that's associated with them. And I'll come back to this point at some point in the presentation. Other coals are slightly better because the quality of the fuel is somewhat better and the amount of pollution that's generated by burning them is lower. I'd like to talk just a little bit about what I refer to as the life cycle of coal, beginning with mining coal. Now, mining coal is a dangerous occupation, and there are occupational illnesses associated with coal mining, most notably black lung disease, or as it's known in the medical literature as coal workers' pneumoconiosis. But you need not be a coal miner to suffer adverse health effects from the mining process itself. And these are data from a study that was done by questionnaires in West Virginia, which is one of the major coal-producing states at home. And these investigators found that if you lived in a county that mined more than 4 million tons of coal per year, the health status for conditions like cardiopulmonary disease, lung diseases, cardiovascular disease, and even some seemingly unrelated diseases such as diabetes and kidney disease all worsened with increasing amounts of mining of coal. And as a specific example of that, if you lived in one of these counties where more than 4 million tons of coal was mined, the risk of developing chronic obstructive pulmonary disease, that's chronic bronchitis and emphysema, was more than 50% higher than if you lived in a county where relatively small amounts of coal were mined. In the United States, some 70% of all railroad tonnage that's carried is in the form of coal. So it is the most important product that's carried by the railway traffic. And railway accidents are much more common per ton mile than any other form of transportation. And this is an example of one of these disasters. This is a derailment that took place in August this summer, and 2 young women who happened to be standing too close to this train as it jumped the tracks were killed in this accident. The problems really become severe, though, when you begin to talk about the pollutants that are produced by burning coal itself. Now, coal is not just a simple lump of carbon that you dig up out of the ground. It's really a very complex mixture of chemicals and elements. And when the coal is burned, these elements and chemicals are released into the atmosphere. And the most important ones in terms of the health impacts are oxides of sulfur, nitrogen, and mercury. But there's also significant amounts of arsenic, beryllium, cadmium, chromium, nickel, hydrochloric acid and hydrofluoric acid that are released. And coal also contains small amounts of uranium and thorium, both of which are radioactive elements that are released into the atmosphere when coal is burned. Now, ironically, as the pollution control devices become more effective in trapping these pollutants and keeping them out of the atmosphere, the ash that's left becomes more toxic. And this is a photograph of a coal ash spill that took place just before Christmas in 2008 at the Kingston TVA, Tennessee Valley Authority coal-fired power plant, where a dam that was holding back a lake that was 84 acres in size failed and released over 4 billion liters of this slurry mixture of coal ash and water into the surrounding environment, including 2 rivers that serve as the drinking water supply for towns that are downstream. And at dozens and dozens of other sites throughout the United States and indeed the world, the ash that's deposited leaches these chemicals, particularly arsenic, into the groundwater supply and contaminates wells and renders the water unsuitable for human consumption. And this is a serious problem everywhere. Using contemporary epidemiological techniques, which are always getting better and better, it's been possible to show that the 4 leading causes of death in the United States have the kinds of air pollution that are caused by burning coal associated as risk factors. So although it makes sense that the 3rd leading cause of death in the United States, respiratory diseases, including asthma, emphysema, bronchitis, and lung cancer, might be caused by air pollution. After all, that's how it gets into your body for the most part. But it comes as a surprise, perhaps to some, that heart disease, the leading cause of death in the United States, is also closely related to inhalation of air pollution, as is malignant neoplasms, in addition to cancer of the lung, and stroke. Now look just for a moment here at the fatal arrhythmia, which is one of the causes of death associated with heart disease. And this is an interesting story from an epidemiological perspective. Now, throughout the United States and in other places, there are air pollution monitoring centers, and some of these generate a value in terms of the concentration of a pollutant, such as small particles, every hour on the hour, 24 hours a day, 7 days a week. Now, some patients who are at risk for sudden death have cardiac defibrillators implanted in their chest. This is a little electronic device about the size of, well, smaller than a package of cigarettes, implanted under the skin, usually here, with electrodes that go into the heart that constantly sense the heart rhythm. Now, these are pretty smart devices, and when they detect a heart rhythm pattern that is potentially fatal, such as ventricular fibrillation or ventricular tachycardia, the device knows that that's happening and begins to try to pace the heart into a normal rhythm. And if that fails, it gives a tremendous electrical shock to the heart. You may have seen that reenacted on TV dramas where they have electrodes on the outside of the patient and they'll say clear, push a button, and the patient jumps up off the bed. But it's and that electrical shock is designed to restore normal heart rhythm. And it's an unforgettable experience. Many patients who have these devices implanted in them have had them go off very frequently, ask to have them removed, even though they know that if it happens again, they're likely to die. But the painful experience is one that they're not anxious to repeat, so they have them actually have them removed. Now, if you have one of these devices go off, you're instructed to go to the emergency room of a hospital, and there a technician will place a device over the pacemaker, and it will talk to the pacemaker and retrieve the exact time that the pacemaker went off and the heart rhythm abnormality in terms of the electrocardiogram that was there. So that's one set of data, the exact time that the defibrillator went off and the heart rhythm that caused it to fire off in the first place. So if you use another set of data, which are the hourly particulate matter concentration data that are generated by these monitoring stations that are located all over the place, it's possible using contemporary statistical techniques to make inferences about cause and effect, or likely cause and effect, and correlate peaks in pollutant concentrations with the probability that the defibrillator is going to fire off. So in using similar techniques, it's been possible to show that peaks in particulate matter concentration are also increase the risk for developing a stroke. So the heroes in this game, from my point of view, are the epidemiologists and the statisticians, plus the scientists who have worked to make the pollution monitoring devices available and those kinds of data available. So it takes a large amount of effort on the part of a substantial number of people to pull all these disparate or seemingly disparate kinds of data together to make a rational story about air pollution. Now, the United States Environmental Protection Agency has identified what it refers to as 6 criteria pollutants. And for each of these criteria pollutants, there's a standard that establishes an upper limit that should not be exceeded for each of these. And one of these criteria pollutants are small particles. And these are particles that have a diameter of 2.5 microns or less. And it's the smaller the particle, the more dangerous it is in terms of producing health effects, because these very small particles are inhaled deeply into the lung, where they trigger pathological processes that cause diseases in the lung and also other organs in the body, such as the heart, blood vessels, the pancreas, and others that produce diseases of a variety of organ systems. And in this figure, you see data from the United States that show that industrial processes, including making cement, which is a process that uses substantial amounts of coal, and generating electricity, are the third and the fourth leading sources of this small particle pollution. And these are particles that are generated at the moment of combustion. I'll come back to that point in a moment. Now, one of the earliest studies that began to attribute the costs of bad health to various energy sources that are used to produce electricity was published by the National Academy of Sciences in the year 2009. And this is a map of the United States that shows the location of some 406 coal-fired power plants. And the size of each of these circles is proportionate to the healthcare damages that are associated with it. So that the largest circles are associated with $500 million per year per power plant. And you can see that the largest number of these are clustered on the eastern part of the United States along the Ohio River, the Mississippi River, and the eastern seaboard, where the hurricane just went earlier this week. And the National Academy of Sciences, which is an organization it's an honorary organization by election, and it's the most prestigious group of scientists in the United States. So this is a very, very highly respected group of individuals and studies. They found that some $62 billion per year in hidden healthcare costs were associated with generating electricity. And this is primarily as the result of oxides of sulfur and small particles that are produced from oxides of sulfur. And I want you to notice the pattern of these power plants in this slide, because in this map of small particle concentration, you see that the pattern is very similar. Again, clustered in the Ohio River Valley, the Mississippi River Valley, and the eastern seaboard. And this map was used using satellite technology, which is increasingly able to make remote sensing measurements that measure the concentration of small particles. So that in a country like Kosovo, where particle monitoring capabilities are not as robust as they are in other parts of the world, it should be possible to use these kinds of satellite monitoring techniques to make the kinds of measurements that are necessary for contemporary epidemiological studies linking disease and particle concentration. Now, oxides of nitrogen are one of the criteria pollutants, and they're important in and of themselves because oxides of nitrogen are very irritating to the lungs to breathe them in. And perhaps more importantly, in the presence of sunlight, oxides of nitrogen combine with volatile organic compounds that are released into the atmosphere to produce ozone, which is an important component of smog. And it's ozone and small particle concentration that are probably the two most important drivers of bad health in the United States at the present time. And you see here that generating electricity is the third-ranked source of these, and followed by fossil fuel combustion and from other sources as the fourth-ranked cause. Oxides of sulfur are also very, very irritating to inhale, and like oxides of nitrogen, form acids in the atmosphere and are responsible for the production of acid rain. But oxides of sulfur are also very chemically active and combine with other constituents in the atmosphere to form these very small particles, those particles that are 2.5 microns in size or smaller. So there are two primary mechanisms for generating these small particles: direct combustion and chemical reactions that take place in the atmosphere. And as this slide shows, generating electricity is responsible for about 4 times as much oxide of sulfur as any of the other sources. Now the coal that's mined from the lignite mines here in Kosovo contains about 0.5 to 1.5% sulfur by weight, an amount that's similar to many coal mines in the United States. But there are some mines in China where they mine and burn much more coal than we do in the United States, where the coal is of very poor quality and contains as much as 10% sulfur by weight. So the Chinese are in a really tough situation when it comes to the amounts of sulfur dioxide that's produced by burning coal. Now, epidemiological studies have very convincingly linked particulate matter concentration with cardiovascular disease and overall mortality. And these are a couple of the studies that have done that. Importantly, the so-called Harvard 6 Cities study, where they measured health outcomes and pollution levels in 6 different cities in the United States. The American Cancer Society prevention study, similar studies that have been done in Europe, all show significant relationships between increases in particulate matter concentration and important health outcomes such as cardiovascular disease and overall mortality. Now, as I mentioned before, I'm a neurologist, so I'm quite interested in stroke. I've cared for way too many stroke patients in my career. And studies in both Korea and Taiwan have shown statistically significant relationships between the levels of various pollutants, including the so-called criteria pollutants and the production of strokes. The Women's Health Initiative study is one that is particularly important in this regard for several reasons. This is a study that was done prospectively, which means that people were enrolled at a point in time where they were actually seen by an intake coordinator and subjected to a variety of tests and questionnaires to determine whether or not they had evidence of cardiovascular disease. And the Women's Health Initiative study enrolled over 64,000 women who were past the age of menopause and at the time that they were enrolled were judged to be free of cardiovascular disease. And then these women were followed on average for about 7 years, each of them. And during that period of time, they were evaluated periodically to determine whether or not they had developed cardiovascular disease in the interim. And this study found that for a 10 microgram per cubic meter increase in the small particle concentration, there was a 24% increase in the risk for a cardiovascular event, such as a heart attack, a stroke, or the need to have coronary artery bypass grafting surgery, or so-called bypass or cabbage studies. So this is an important study because of the size of it and the fact that it was done prospectively, which gives it additional power and a weightier form of evidence. Now let me shift gears to talk a bit about mercury. And these are data from a United Nations Global Mercury Assessment that was published in 2008. And this shows that by far burning coal, which is the fossil fuel combustion blue portion of this pie chart, accounts for almost half of the mercury that's emitted into the environment as the result of human activity. And coal has enough mercury in it that it is an important and indeed the leading source of mercury pollution throughout the world. And this is another map, this time of the entire world, looking down from the North Pole on a polar projection. And it shows the rate of deposition of mercury in various countries, particularly in the northern hemisphere. And again, in the United States, you see that same pattern of mercury deposition that you saw for the particulate matter concentration and the health costs associated with burning coal. But this map also includes large portions of Europe, particularly Eastern Europe, and importantly China, where they burn much more coal than we do in the United States. Not on a per capita basis, but on a per country basis. They burn substantially more. And there have been computer modeling studies that showed that a plume of mercury emitted in the eastern part of China is likely to travel to North America on the westerly winds that blow in the northern hemisphere. Now let me begin to come to conclusion of the presentation by talking a bit about global warming. Let me talk about the health effects first. And these are varied and likely to become quite substantial. Drought and starvation are perhaps at the top of the list, and I'll return to that point in a few moments. Heat-related illness, almost intuitively obvious that as the climate warms, you're going to have more trouble with heat-related illnesses. But there was a heat wave in Europe in the beginning of this decade, or the last decade rather, that killed over 50,000 people. And these were premature deaths. These were not people whose death was postponed by or accelerated by a week or so. These were people who died who weren't expected to die in the near future. As the Earth warms, ice caps will melt and sea level will rise. And diseases like malaria, dengue, which is a viral disease that's carried by mosquitoes, just like malaria. Malaria is a protozoal disease. Dengue is a viral disease. Cholera and other viral encephalitises such as West Nile virus and hantavirus, which is a pulmonary virus, are all likely to increase in their prevalence and importance as adverse health effects. Now, plants use carbon dioxide during the part of photosynthesis, and there are some people who say, well, carbon dioxide is good for plants because it makes them grow. Well, indeed it does, but it makes all kinds of plants grow, including ragweed, which is an important source of pollen that causes allergic reactions in the respiratory tract, causing precipitating attacks of asthma, and the probability that severe weather events is also going to increase. And there are very good data going back over the last 200 years or so that track the prevalence of severe weather events, and they're increasing in frequency. Now, I won't blame Hurricane Sandy on global warming, but we're likely to have more Hurricane Sandy-like events in the future as a result of global warming. Now, one of the important dialogues, or sometimes monologue in the United States, is global warming real? Well, the answer to that is convincingly yes, and I'll show you the result of that. There are 4 different groups of scientists who are working independently who've also all basically come to the same conclusion, and that is that the average Earth temperature has risen by about 0.8 of a degree centigrade over a 25-year period or so. Is it caused by human activity? Again, the answer is yes, and there are at least 4 or 5 different kinds of scientific data that are independently derived that all point to human activity as the cause of the increases in carbon dioxide and hence the increases in global temperatures that have been observed. It's highly correlated with the use of fossil fuels, and I'll show you a slide of that in a moment. The concentration of carbon dioxide has gone up steeply, particularly as shown by a fellow by the name of Keeling, who was the first to develop a technique to measure the concentration of carbon dioxide in the atmosphere, and he and his lab successors have been doing that now on an hourly basis since the late 1950s, and the Keeling curve shows a steady rise in the concentration of carbon dioxide. But superimposed on that is an annual variation where carbon dioxide levels peak in early spring and then begin to fall during the summer as plants in the northern hemisphere incorporate carbon dioxide through photosynthetic processes, causing a transient and small dip in the CO2 concentration. There are also radioisotope ratio data. There are 2 non-radioactive isotopes of carbon that occur naturally, carbon-12 and carbon-13. About 99% of all carbon is in the carbon-12 form, and about 1% as carbon-13. plants preferentially use one of these isotopic forms over the other for reasons that I don't understand completely, but it's well known. And if you compare the ratio of carbon-12 to carbon-13 in present-day atmospheric samples with the carbon-12, carbon-13 ratio in atmosphere samples that have been stored, say, for the last 100 years or longer, and the carbon-12, carbon-13 ratio that's present in fossil fuels like coal, you find that the atmospheric ratio is moving steadily towards the ratio that's in coal and other carbonaceous fossil fuels, leading to the conclusion that the carbon dioxide that's being added to the atmosphere has to be coming from some plant source, notably coal and fuel oil and natural gas. And these are data that show that the concentration of the three most important of the greenhouse gases, carbon dioxide, methane, and nitrous oxide, has increased steadily beginning at the time of the Industrial Revolution. And actually there are atmosphere samples from over 400,000 years ago that have been recovered from ice core samples that have been recovered by drilling core samples deep into Arctic and Antarctic ice samples that show that the carbon dioxide concentration has barely crept over 300 parts per million for the last 400,000 years or so. And that concentration is now up to almost 400 parts per million. And that this increase began at the time of the Industrial Revolution, when we began to burn large amounts of fossil fuels such as coal and fuel oil to produce the energy that has fueled the Industrial Revolution. Mining coal is an important source of methane releases into the atmosphere because there are large amounts of methane that are trapped in coal beds. And some of the explosions and disasters that occur in mines are the result of sparks triggering off explosive reactions between oxygen and methane in coal mines. Now, as I said before, there are 4 independent groups that have all concluded that the global temperature is rising, and this is a map showing the difference in temperature between the decade between 1950 and 1960 and the decade that began in the year 2000, ending in the year 2010. And there are some places on Earth where the average temperature is increased by more than 2 degrees centigrade. Overall, the global atmosphere, the global surface temperature is increased by about 0.8 of a degree centigrade. Now this is, these are data from a guy by the name of Muller, who was one of the increasingly small number of real scientists who were skeptical about climate change. And his study was paid for by the Koch brothers. I don't know if you know who the Koch brothers are in this audience. They're very wealthy brothers who are very conservative politicians who don't believe that global warming exists. They think it's a hoax. So they gave this guy Muller, who was skeptical about global warming, enough money to reevaluate the data, and Muller published his data. And I'm sure it disappointed the Koch brothers because he came to the same conclusion that the 3 other independently operating groups had, and that is that global temperatures are rising inexorably. Now, then, as I said before, the number of severe weather events is increasing and is likely to continue to increase. And this is a map of the drought that's occurred in the United States this summer. Most severe in the Midwestern states, where they grow large amounts of soybeans and corn. And as a result of the increases in the temperature and the decrease in rainfall, crop yields have fallen substantially during this particular growing season. And at the end of August of this summer, the World Bank published a report that said that world food prices rose by 10% in just 1 month, the month of July, and that the cause of this increase was a shortage of food that was caused by the drought in the Midwestern part of the United States. So what are the implications of this? Well, if food is is more expensive, and there are already large numbers of people who can't afford to buy enough food to nourish themselves and their children properly, the prevalence of malnutrition is almost certainly going to increase. And this is a figure from another study published by the World Bank that shows that in some of the less developed countries, particularly India and sub-Saharan African countries, the prevalence of malnutrition among children who are younger than 5 years of age reaches almost 50%. So this number of people who are malnourished, particularly children, the most vulnerable members of society, is almost certain to increase as droughts and severe weather events occur. Now, not shown in this slide is the effect of sea level increases. And these are likely to be the most severe in the lowest parts of countries where the population density is the highest. And the three sites that are the most vulnerable are the delta of the Nile River, the delta of the Mekong River in Southeast Asia, and the delta of the Ganges Brahmaputra River at the border between India and blocking on the name of the country, Bangladesh. Thank you. In each of these three delta regions, it's likely by the year 2050 there will be upwards of 1 million environmental refugees who will be pushed from their homes because they're flooded and no longer inhabitable. So, I shouldn't end on such a dreary note, because it is possible to do something about this, and that is to develop energy sources and utilize energy sources that are non-polluting and that are sustainable. And one of these we've installed in our home here in Buffalo, here I was 5,000 miles from here, where we've installed a photovoltaic solar array that generates about 80% of the electricity that we use in our house. What we need is support for education that's in turn necessary to fuel the kinds of research and development that are necessary to move us into a sustainable energy future where we no longer rely on burning fossil fuels like coal and natural gas and oil in order to be able to meet the energy demands of the next century's economy. In addition to having a PV array on our house, we drive very energy efficient cars, and as the compact fluorescent bulbs in our house burn out, we replace them with light emitting diodes. So hopefully on a slightly more upbeat note, I'd like to thank everyone for the very kind invitation to be here this afternoon to talk about some of the things that I highlight in the book that will be available for loan in your library as soon as President Hall gets it down there, and that people can catalog it. And if you can't wait, you can go to Amazon and purchase either an electronic or a physical book. So thank you all very much again for being here.
Thank you, Dr. Lockwood. We're not done yet.
Okay.
Questions?
Could you talk about there's a current advertising campaign on various media outlets in America for clean coal. And I have a personal take on that, but I'd like to hear from you since you're the expert.
Clean coal is a phrase that is now more than 2 decades old and arose at a time when coal mines began the widespread practice of washing the coal to remove something like 30% of the stuff that comes out of the mine that's not combustible, like rocks and dirt. This creates its own waste stream, which causes its own set of problems. But that was the origin of the phrase. More recently, though, that's been transformed into a much broader meaning that has to do with the increasing ability of pollution control devices to remove the hazardous air pollutants, with the exception of carbon dioxide, from the gas stream that goes up the stack and into the atmosphere. So that's part of the contemporary meaning of clean coal. The other meaning of clean coal that is being pushed particularly by the coal mining companies and the electrical utilities is what's referred to as carbon capture and storage, or CCS. This is, I made my living for over 40 years as a research scientist, so I would be the last person to say we shouldn't be doing research on something. But I'm not very optimistic that carbon capture and storage is going to be a practical solution to dealing with the more than 30 trillion tons of carbon dioxide that we pour into the atmosphere every year. And the reasons for that are severalfold. First of all, it's going to be a very expensive and energy-intensive process. Some estimates are that as much as 40% or perhaps even more of all the electricity that would be produced by a CCS power plant would be required for the capturing and sequestration and transport of the coal. So the coal companies are very enthusiastic about this because what does that mean for them? Mining even more coal and making even more profits. So they're behind this campaign for clean coal to a large extent. Imagine having a new waste stream that requires you to deal with 30 trillion tons of waste that we're not doing anything with right now. It would require an enormous investment in infrastructure worldwide to purify the waste stream from coal-fired and other power plants so that it's almost pure carbon dioxide, compress the carbon dioxide into a liquid form, transport it probably by pipeline, which is the most efficient way of transporting large volumes of liquid, and then storing it in some manner that has yet to have been devised satisfactorily so that it never gets into the atmosphere forever. I mean, it's sort of like the problem of storing radioactive waste. If it ever escapes, you've failed in your job of storage. And none of these processes are going to be 100% effective, 80 to 90% perhaps. And even that may not be enough to prevent injection of the amounts of carbon dioxide into the atmosphere that are causing global warming to occur. So I'm not very enthusiastic about the prospects for carbon capture and storage. I'm much, much more enthusiastic about using, say, solar energy and using that for artificial photosynthesis or photocally driven electrolysis of water, where you split molecules of water into oxygen and hydrogen. You can store both of those gases, burn them up again to make more water again, so that at night when the sun's not shining, you have a source of energy, sort of like a battery that you use. So these are the kinds of technologies that I think that we ought to be investing substantial amounts of money in terms of research and development to solve the problem of how to generate electricity for the next generation of industrial progress.
You mentioned that there's a nuclear component to the coal. How significant is that among the risk factors that coal creates? How big a deal is that?
It's pretty low, actually. There are some people who would probably tell you that more radiation in the form of uranium and thorium and the decay products of those two elements that comes from a coal plant is greater than it comes from a nuclear reactor. But they're relatively small amounts. But as with the case of all of the other hazardous air pollutants that are produced during the process of burning coal, as the pollution control devices become more effective, the concentration of those in the coal combustion waste goes up. So it's a problem, but it's certainly not on the order of magnitude of the threat that heart disease or cancer or changes in sea level or expansion of the footprint for diseases like dengue and malaria pose for the future.
The second one that I wanted to ask you about is you mentioned a set of criteria pollutants. Given what you know about coal, is there anything else that should have been added to that list, knowing what we know now? Maybe we should have added 10, 20, well, 30 years ago?
I don't think so. And during some of the presentations that I've heard this week, I think the importance of arsenic that's in coal combustion waste and the hazardous air pollutants is underestimated by some. Arsenic is really nasty stuff. How many of you know the story Arsenic and Old Lace? It's about a little old spinster lady who puts arsenic in elderberry wine and poisons the men that she rents an apartment to. But arsenic, it's what's referred to as a Class A carcinogen. It's a known carcinogen in humans, and it predisposes to developing a wide variety of cancers: lung cancer, carcinoma of the kidneys, urinary bladder. It's also an element that causes diseases of the peripheral nerves and skin disease. And there are standards for arsenic concentration in drinking water in the United States, and in many places the storage of coal combustion waste and the arsenic that leaches out of that coal ash repositories into drinking water has made the drinking water unfit for human consumption. And also the mining processes that are increasingly in use, like one called mountaintop removal and valley fill, where they literally remove the tops of mountains in order to expose seams of coal and push the tops of the mountains into a valley. And when you expose these rocks that have never been exposed to the atmosphere before and it starts raining on them, the arsenic leaches out of those rocks and gets into the water supply. There are many places in West Virginia, for example, in Kentucky, where this process is quite widespread, where drinking water supplies have been ruined by arsenic concentration.
Other questions?
Do you think that if we would do all those changes, go clean energy, the world will it cool down, or will it just stay at the temperature we have right now?
The three most important global warming gases, carbon dioxide, methane, and nitrous oxide, all stay in the atmosphere for very, very long periods of time. So even if by some miracle we were able to put a complete stop to the emission of carbon dioxide right now, right as I'm speaking this instant, temperatures would continue to rise for probably several decades because of the persistence of these gases in the atmosphere. So it poses really a very long-term problem that really no one has the sense of urgency to attack at the present time.
I wanted to dwell on clean coal a little longer. I'm currently a fellow in the Economics Unit, but last year I was working in the Centre for Energy and Natural Resources here in the UK. We work on mining and energy policy, and as part of a research trip that the university had in partnership with the Purdue University in Indiana, we had the chance to visit this new power plant that's going to be open and commissioned very soon, actually, in Edwardsport, in Indiana. That's supposed to be at the cutting edge of clean coal technology worldwide. And I'm not an engineer in the least, but as far as I could understand from the process that was explained to us, the core of the technological innovation at the plant was that the coal was not combusted, was not burned, but it was used to extract gas out of it that is then combusted.
And make either hydrogen or methane gas out of it. Right.
And as far as I can understand from the presentations at the time, the main gain was in terms of reductions of carbon monoxide emissions or dioxide emissions. But when it comes to particulate matter, nitrogen oxide or sulfur oxide, that was pretty much the same as regular.
Well, some of these integrated gasification type processes produce methane gas as a product. And as soon as you burn the methane gas, you're generating carbon dioxide that will go into the atmosphere. Plus, there's still all of the mining and the disposition of the waste stream that comes out of the other end of the plant. So while it's undoubtedly true that these kinds of power plants will have substantially lower emissions of some of the criteria pollutants and also carbon dioxide, they still rely on fossil fuels, and eventually our fossil fuel supply is going to run out, where it's going to become so expensive that no one would dream of burning it. 200 years from now, it is likely, assuming that something drastic doesn't happen between now and then, they'll look back and say, those primitive people actually burned this stuff in order to make energy instead of using it to make some pharmaceutical or some chemical that is impossible to make from other sources.
So is it just yet another smoke screen? Is it yet another smoke screen, the gasification of coal?
Yes, as part of it, I think it's preferable to certainly what you have here in Kosovo, A and B, but it's still a fossil fuel dependent and a non-renewable energy source that's being required. So I don't think in the long run, looking 200 years and down into the future, it might be a reasonable interim step, but ultimately you can't, there's a limit to the amount of fossil fuels that are present on the planet.
In back.
I wanted to come back to the climate changes. Another argument by the scientists stated that the climate changes is just a cycle, that before the climate used to be hotter and then it got colder and now it's getting hotter. How is that relevant to the topic here?
Well, there have been natural cycles in temperature, and those have been very closely linked to the concentration of carbon dioxide in the atmosphere. And as I said before, there's a very good record of CO2 concentration in the atmosphere that extends back to over the last almost 435,000 years. And the things that are different about the present situation compared to historical warming and cooling cycles that have occurred is the speed at which the Earth is warming now, which is far faster than anything that's ever been observed before, and the concentration of carbon dioxide, which is far higher now than it ever has been for the last more than 400,000 years. So I think this is one of those arguments that's sort of a logical fallacy. It's occurred and it's occurred naturally, so in the past, so what's occurring now is just part of a natural cycle, but it's so much more exaggerated at the present time than it has ever been, and it's difficult to conclude anything else other than that this is a part of the results of human activity. There's somebody else who hadn't had a question. The woman who's sitting next to you.
Well, I look at this and I say, I can't see that happening in Kosovo. And so my question is, there's no silver bullet, but would you have suggested, what would work in Kosovo from what you've seen in Kosovo? What would work?
The cheapest thing to do, I think, almost anywhere is to improve the efficiency with which we use energy by improving the insulation in homes, improving the standards for construction of new buildings. Simple things like the city of Chicago has a very advanced program for dealing with that, and they've done really simple things like painting the roofs of the buildings white instead of black, which decreases the amount of energy that's absorbed by the roof and the need for air conditioning. When our house was built in 1911, and when we had some work done on the house, we discovered two things: that we had very big spaces between the interior wall and the outside wall of the house, and the other thing that we discovered was that there was nothing in there but air. so we filled it up with insulation. It was quite expensive, but in about 3 years we recovered the entire cost of insulating our home. And it also made it much more comfortable to live in. So improving the efficiency with which we use energy is the cheapest thing. We waste almost half of the energy that we produce.
I realize you're a neuroscientist, not a political scientist, but in America, the gas, oil, and coal lobby is one of the most powerful lobbying organizations, probably, well, in the country certainly, probably in the world. And before Kosovo goes down that slippery slope, and is still a, you know, it's not a young country in terms of its cultural heritage, but it's as a politically independent country, it's very new. What suggestions, based on your experience, would you suggest, and how can medical world establishments help support the transition from fossil fuel to more efficient forms in a young country?
Yeah, well, I tried to do my part. That's a tough question, and there are a number of ways to approach that. One of those is an economic argument. It's much, much less expensive to prevent a disease than it is to treat the disease once it starts. And that's a fundamental premise of all public health measures, you know, from making municipal water supplies available to people, putting fluoride in the water, and vaccinating kids so that they no longer develop polio or smallpox. The same thing, same strategy can be applied to energy use. And the EPA, the Environmental Protection Agency in the United States, is required as a part of the Clean Air Act to make periodic reports to Congress and to the public about the relative costs and benefits of implementing the provisions, what some politicians refer to as the job-killing regulations, which is sort of a poison pill, versus the healthcare benefits. The most recent of these reports was published in March last year, and the EPA, using very conservative modeling techniques, concluded that by the year 2020, the savings in terms of preventing something like 230,000 premature deaths per year, 2.5 million attacks of asthma, something like 17 million fewer lost days at work where employees are being paid sick leave, but they're not doing anything productive. The healthcare savings are on the order of $2 trillion per year. $2 trillion per year. And the cost of complying with these regulations is on the order of about $65 billion per year. And of that $65 billion, about $10 billion would be attributable to the electrical generating unit modifications that are required by the Clean Air Act. Now, I'm a retired guy and I live off of, you know, the income from my investments and things that I made when I was working. I don't have any investments that pay that kind of cost-benefit return. So investing in clean energy is a way to solve a number of problems. First of all, it gives people like you and me and my children and my grandchildren cleaner air to breathe and better health. It saves an enormous amount of money in the healthcare industry, which is probably a problem there in Kosovo, as it is in every other country in the world. And it also is a way of attacking the increasing debt that countries like the United States and others have. So it's a win-win-win situation, I think. You get better air, better quality of life, you save on healthcare costs, and you provide a very tangible way of assaulting the debt problem that affects us. So I don't think, you know, looking at it from a public health perspective, we can't afford not to do that. And in fact, I write in the book that even if the federal government in the United States paid for all of the costs of modifying coal-fired power plants, the federal government would be ahead of the game. They'd be spending at the most $65 billion a year, but the cost to the Medicare and which is the healthcare plan for people like me who are retired and over 65 would be enormous. And the Medicaid program, which is basically the insurance program for poor people in the United States, would be reduced. Now, you mentioned the amount of money that these companies have available for lobbying. The coal companies spend a larger fraction of their income on lobbying than defense contractors and cigarette manufacturers do. So, I mean, they're out there creating jobs, all right, in the lobbying industry. But there is no lobby. So that's the people who are lobbying on behalf of the people who might have to spend $65 billion. There aren't any people out there. Is no Medicare lobby. There is no Medicaid lobby in the United States. So the people who are the most vulnerable members of our society, who are the most likely to benefit from that, are politically disadvantaged and depend on people like me and you to go out there and, shake the tree and make things happen.
I have one quick question. Since you've been here, have you had a chance to talk to local healthcare providers about your work, the impact of coal on their work here?
Yeah, I've had a couple of meetings with them. Some of them have been really quite agitated. This is the calmest audience I've talked to since I've been in Kosovo. Some of the healthcare people who were present at the noon meeting that we had today, sort of a mini symposium, and particularly some of the people who live in the area of the Kosovo A and B plants were really very, very agitated by the unresponsiveness of the company and the government to be able to implement effective measures to curtail the pollution that's coming from those two plants. I mean, at home I'd be worried that one of those guys might be ready to hit somebody.
Other questions? All right, well then, thank you guys.